Hi, I'm Dr. Jordan Weiner from Valley ENT. In this video series, I'm going to discuss obstructive sleep apnea. In this video series, I'm going to discuss what obstructive sleep apnea is, how common it is, the symptoms of obstructive sleep apnea, the potential consequences of obstructive sleep apnea, and how it's diagnosed. We're also going to discuss treatment options including CPAP, oral appliances, and surgical options. Obstructive sleep apnea refers to recurrent collapse and obstruction of the throat during sleep. The obstruction can last up to about 40 seconds. Obstructions can be partial, which we refer to as hypopnea, or complete, which is called apnea. This results in a cyclical breathing pattern and fragmented sleep, alternating between sleep and arousal. Occasionally people wake up, but usually they don't. Obstructive sleep apnea is relatively common, affecting about 25% of the adult population. More severe cases of moderate to severe obstructive sleep apnea affect about 10% of adults. Symptoms of obstructive sleep apnea include not feeling refreshed in the morning, sleepiness and fatigue during the day, frequent awakenings during the night, waking up with a headache, impaired cognitive function, loud snoring, and gasping or irregular breathing seen by a sleeping partner. However, some patients do not have any symptoms and don't know they have a sleeping problem. There are potential consequences of untreated obstructive sleep apnea, resulting in an overall increased death rate due to increased incidence of hypertension or high blood pressure, abnormal heart rhythms such as atrial fibrillation, coronary artery disease, heart failure, and increased auto accidents. These consequences can occur whether or not there are any symptoms of the sleep apnea and are directly related to the severity of the sleep apnea, not the presence of symptoms. Obstructive sleep apnea is diagnosed on a sleep study. This can be performed in the lab or using a home sleep test. We characterize obstructive sleep apnea as mild, moderate, or severe. In mild obstructive sleep apnea, there are between 5 and 14 obstructions per hour of sleep. In moderate obstructive sleep apnea, there are 15 to 29 obstructions per hour of sleep, and in severe sleep apnea, there are 30 or more. Low oxygen levels can occur with moderate and severe obstructive sleep apnea. For most adults with obstructive sleep apnea, positive airway pressure therapy, known as PAP therapy, is the first line of treatment. Positive airway pressure or PAP therapy is a small breathing machine connected to the patient by a hose and worn on the face. This is successful in about 50% of patients. For successful PAP users, the therapy can be life-changing. For others, it may not be possible to fall asleep or stay asleep with PAP therapy, or the PAP therapy may result in significant disturbance of sleep. In these cases, other therapies will be needed. One alternative to PAP therapy is an oral appliance. This is usually made by a qualified dentist. The oral appliance is worn in the mouth between the upper and lower teeth and pulls the lower jaw forward during sleep, opening the airway. This is successful overall in about 40 to 50% of patients, usually in mild to moderate cases. Surgery can also represent a treatment option for patients intolerant of PAP therapy. Tonsillectomy is one surgical option, particularly in patients with large tonsils. Another surgical option is a procedure known as a uvulopalatopharyngoplasty, aka UPPP. In this procedure, the surgeon removes the tonsils, if any are present, and trims and reshapes the soft palate to widen the back of the throat. This has an overall success rate of about 50% and represents a good option for a limited number of patients. Finally, for patients intolerant of PAP therapy, there is Inspire therapy. This was approved by the FDA in 2014 for the treatment of moderate to severe obstructive sleep apnea in patients intolerant and not benefiting from PAP therapy. In this procedure, a nerve stimulator is placed in the right chest, which sends an electrical stimulus to the nerve that moves the tongue. When a breath is taken, It moves the tongue forward and out of the airway. It's only active during sleep and is completely off during the day. Overall, Inspire has about an 80% success rate. Please watch my video on Inspire therapy for more information and details.